Bangor is on track to surpass fatal overdose numbers compared to last year. The June 2026 Maine monthly overdose report says in 2025, 35 people in Bangor died from an overdose. This year, that number is already at 23. City officials say fatal overdoses in Bangor have always trended higher than the rest of the state. Data analysts also say counties that have cities are more likely to see an increase in drug activity and deaths compared to rural counties. While no one specific cause can be cited for the increased overdose deaths, public health officials say the drug supply, people using drugs alone, or those coming out of jail being particularly vulnerable to overdose could all contribute. For the city, strategies are about meeting folks struggling with addiction where they're at.
The presence of urban areas really is a big factor in the level of drug deaths. And that's because the trafficking is higher in urban areas.
People who are struggling with addiction, who are experiencing overdoses, they're really, really struggling. And it's important to keep investing because, someone might not be ready like after being approached the first time, but they may be ready after they've been approached the third or the fourth time. And by continuing to invest those resources, it means that we're ready as a community to support somebody when they're ready.
To combat these fatal overdoses, public health and community services say they're utilizing partnerships and funding. They point to Bangor being a Tier 1 naloxone distributor, making what's commonly known as Narcan available, as well as trainings in using it. They also credit community partnerships in extending outreach to at-risk populations, as well as using opiate settlement fund money to strengthen case management and clinical services for those who use drugs.